Hi, everyone. Hospice Nurse Julie here. Happy Super Bowl Sunday. I just realized it's the Super Bowl. No one's going to come to the live. You guys are all too busy watching football. Anyone who shows up, you are diehards. You are diehard Hospice Nurse Julie people. You're my people. Come on in. Welcome. If you don't know who I am a hospice nurse who educates about death and dying to normalize, so funny, to normalize the most normal thing in life, which is death. So funny. I come on here and I start seeing how I look and then I play with my hair and stuff. Hey, everybody. There are some people here. I just remembered Super Bowl Sunday, so I feel like it's going to be a small crowd, which will be nice for you guys. So please ask your questions. If no one has questions, I'm happy just to sort of start talking about main things I think it's important for people to know. Welcome, everyone. Okay. Shane, please talk to your doctor about that. But I do recognize your name, and I'm really glad you're here. So I can't give medical advice, people. That sounded a little harsh. I didn't mean to. I just can't give medical advice. It would be wrong of me. I would talk to your doctor. But I'm glad you're here. Thanks, Louise. Thanks, everybody who's joining. Happy Super Bowl Sunday. Welcome. Why is morphine used for comfort? So not everyone will need morphine. I wouldn't say it's used for comfort. I would say it's used for pain or shortness of breath. So not everybody needs morphine at the end of life, but it can be used for pain or shortness of breath. So Angela said, I wanted to know how to set up death with dignity. She called it passionate suicide. I would not call it that. I would call it's death with dignity. It's a choice to end your own life if you have a terminal illness and meet criteria. You have to live in the 11 states where it's available. Just Google deathwithdignity.org and they'll be able to tell you. If you're not in one of those states, you would likely have to move to one of those states. How does one find a unionized hospice provider? Ooh, that's a tough one. Chris, if you're a nurse, I would say it's hard to find. Certain states are more unionized as nurses than others. Like I'm in California, so many places are unionized, but other places are not. And it's tough to find that out. I would try Google. I wouldn't ask your provider. If you're like at an interview, I wouldn't ask. How long does it take once you take your last breath to go into rigor mortis? I actually don't know the exact time. I think everyone might be different. There's probably a generalized time, but I don't actually know. Hi, Carol Clausen. Nice to meet you. Glad you're here. So Ginger, as long as someone stays on dialysis, they can live for a very long time. It's the point where they stop tolerating dialysis or they don't want dialysis anymore. Then usually the time frame after stopping dialysis is 7 to 10 days. I think you've talked about people seeing dead loved ones when getting close to passing over. My dad saw me. I wasn't dead. I was on an airplane to the hospital. Oh, interesting. And then she said, do you have any thoughts on that? I do not have any thoughts on that except for we don't know everything, right? So like, I feel like there's a lot of strange things that happen that we don't fully understand, especially at the end of life. Ooh, whoops. I'm just going through each question one by one. So thank you for all the questions. I will eventually get to yours. Give me 1 sec. Welcome, everybody. Oh, Shane, I'm glad you never missed my lives. I'm sorry I can't help you more. I'm so glad you're here. Someone said, yes, my local team, Kansas City Chiefs, are playing in the Super Bowl. How does it help for shortness of breath? So morphine helps with shortness of breath because it relaxes your diaphragm and relaxes your central nervous system. It doesn't really take away the shortness of breath, but it takes away the feeling of being short of breath, which is bad. The feeling of being short of breath is the bad feeling. So it takes that away. Yes, Louise, that sounds about right. How does hospice support happen in a care facility? The care facility takes on most of the care, the day to day care, and the hospice is just there for support and for someone that they can call when issues come up, since they can't take the person to the ER anymore. Why do they place half of a large slice of onion under the bed of a dying cancer patient? David, I do not know. If anyone out there knows, please tell me. Someone's watching from the Philippines. That's amazing. What about people in hospice that have wounds? Wound care comes and acts like they couldn't care less. Yes, Jennifer, I'm glad you're here. Thank you for asking that. So, wound care on hospice, it's not that we don't care. It's that I'm sorry if they act like that. That's not really what, it's not that I know personally for me, it's not that I don't care. It's that, um, we know in order to get wounds healed, you have to have good nutrition, good circulation, a full working body. And in order to have skin breakdown happening, usually that's already not happening. So they don't have good nutrition, they don't have good movement, they don't have good circulation because the skin is an organ. And just like the rest of the body, it's shutting down. So our goal is not healing, our goal is decreasing chance of infection and comfort. So, although we need to keep the person clean, right, safe and comfortable, and try to keep that wound from being infected, we also want to take into account if it really, really hurts when we change the wound. We're not going to insist it's changed twice a day, or we're going to aim more towards comfort versus healing the wound, because the wound, even when someone is like perfectly healthy and has a wound, it's hard to heal a wound. So it's more focused on keeping it free of infection and keeping the person comfortable. So when someone gets a wound, it's like not an emergency. It's kind of almost expected, especially with some people. Why do people in the dying process hold out hands so hard from France? Maybe you're talking about like the death reach. We're not actually sure why people hold on to hands so hard. Maybe that's what you mean. Yeah, there are people who seem to squeeze people's hands at the end of life. It could be a reflex, a biological reflex. It could be just hanging on to loved ones. If you're talking about the death reach, we aren't really sure why that happens, but we do see it a lot. And as long as they don't seem agitated by it, I just let it go. Congrats on the 7 years of sobriety. Thank you, Scott. I just celebrated in my meetings yesterday, and I'll get another celebration again today. Thank you. My mom was with us for palliative care. She had the morphine driver for her last few days and was sleeping constantly. Do you think she could hear us talking to her? Yes, I do think that. We do think most people can hear us, even if they aren't responding, just because the hearing sensor of the brain is the last part to shut down. How do you know when it's time? Oh, how do you know when it's your time to go? I don't know. I haven't felt that. I do see other people on hospice feeling like that. So I think our bodies are way more intuitive and way more in touch with our surroundings than we know. And I think when you're getting close to death, you're slowing down, slowing down, slowing down. So it's easier to be a little more in touch with your intuition and with the universe, for lack of better words, around you. And I think some people can feel that, hey, I'm going. Not everybody, but some people. Oh my gosh, Shane, that's amazing. Shane said, I did get accepted into MD Anderson, so I'm heading down there tomorrow. I'm pretty excited to see what they can do for me. Shane, that's amazing. That's amazing. Congratulations. I'm excited for that. I'm excited for you too. Nurse watching from the UK. Hey, people in the UK, it's not the Super Bowl for you, baby. I lost I keep trying to go one by one down the questions. You're like me, not watching the Super Bowl. Thank you for your videos. Thank you guys for being here. Richard says, you're hot, Julie. Richard, I'll take it. Thank you. You're hot. Everyone is hot. I am reading some of these statements. Thank you, everybody. Thank you for being there for your loved ones. Do you think when we pass, do we know if we are alone or not? Really enjoy watching you. You're a special person. Thanks, Lori. I do think people know if they're alone or not, but I also don't think they feel alone, even if they actually are literally alone in the room. Personally, now this is just a belief. I don't think people really feel alone. One, I think some people choose to die alone. Two, I think when we die, even if we are quote unquote alone, like there's no other living humans in the room, I don't actually think we are alone. So I think they're okay. Do you know how fentanyl patches work? Because mine doesn't seem to be working. Yes. So Shane, fentanyl patches. So fentanyl patches, one, you have to put them on a fatty area of your body. So if you have it like on your chest or on a bony part of your body, it will not absorb very well. So put it on a fatty part of your body, the back of your arm, your butt, like on a fatty tissue area, your thigh. So that needs to be one. Two, fentanyl, the patch is changed every 3 days. So it's released hour by hour slowly. And usually takes, if you're new to the fentanyl patch, if you just put it on, it usually takes at least 12 to 48 hours to fully get into your blood system. So give it some time before it works. Now, if you have had this patch on for many weeks and you don't feel a difference, they should either increase the patch or try something else. But make sure it's on a fatty tissue area of your body. Some people, fentanyl patches work amazing. Some people, they don't. So it just depends. But it does take some time for it to fully kick in. What if you are terminally ill and don't live in one of those states? What would your options be? This is for the death with dignity. So there are 11 states in the US that allow you to end your own life if you have a terminal illness with less than 6 months to live. If you meet the criteria, which I don't feel like getting into right now, but you can just go to their website, deathwithdignity.org. Some states have certain rules. Some have other rules. Some states are more lenient than others. But unfortunately, if you don't live in one of those states, you would have to move and have residency in one of those states and then get healthcare and insurance in one of those states and then see a doctor who can sign off for this. So it'd be a very long and tedious, annoying process. That is the only option I know as of now. My father refused to put his legs down and they permanently stayed like that for over a year, put pillows to relieve pressure behind his kneecaps, but a wound eventually opened up. Yes, that can happen all the time. Megan, you gave me money. You're so sweet. Proud of your sober anniversary. And yeah, I got verified on TikTok, everybody. Woo woo. Thank you, Megan. You are seriously the best. Thank you, Karen. How has working in hospice changed step 12 and practicing these principles in our life? That's amazing. I do always put my work, like when I do a 10 step every night with my sponsor via email. We're talking about my sobriety now and the program of AA, which I do speak openly about because I'm really involved in it and have been for the past 7 years. I do put work as part of my 10th step, meaning like ways I've been not selfish. And I do try to practice the principles of AA in all of my affairs, and work is one of those ways. I do, however, practice really good boundaries with work too, so I don't overdo it. Do you smoke cigarettes? No. I used to smoke cigarettes many years ago. What's the youngest you can be to consider hospice and euthanasia? Hospice, you can be any age if you have a terminal illness with less than 6 months to live. The criteria for pediatric hospice is a little different than adult hospice. We actually don't call it euthanasia. We would call it like death with dignity or medical aid in dying, just so you know. And you can't consider it in every state, only the states that do it. When my mom passed, I saw a light in the corner of the ceiling. I saw my family that passed standing around. That is amazing. I believe you. My grandfather kept saying he saw our dead relatives 1 week before he died. Yes, very normal to hear. It's called visioning. It happens with countless people I see every day. Isn't that wild? Isn't that wild? It's wild. Yes, Louise said an air mattress helped with pressure sores before and after. Yes, so mattresses can help, turning people can help, but sometimes you can take the best care of someone's skin and they still will get skin breakdown. So please don't feel like it was your fault. And I lost my place in line for these questions. Let's get back to where I was. Okay. 73-year-old male just got home 3 months in a coma. I thought I saw dead wife. Larry, you may have. Thank you, Julie Marvin. So someone said, because someone asked earlier, why do they put onions under someone dying? And it says onions absorb toxins from the area. Good to know. I don't know if I believe that, but I'm not calling you a liar, Glenna. I just mean that might be an old wives' tale. Wives' tale? Wives' tale. I don't know. My mom is 96, lives with us. She's been on hospice for over a year. She's doing well enough that hospice may release her. We love all that hospice does. Any tips on helping her stay on hospice? Oh, Kathy, the only tips would be make her sick, which you don't want to do that. They eventually have to take her off, unfortunately. And then I talk about this all the time. It's totally unfortunate. People shouldn't have to I think Alzheimer's, dementia, Parkinson's disease, like these like COPD, CHF, they need to have their own category. But there's nothing you can really do except for give her wounds, make her have an infection, show that she's lost weight, have her stop eating, and you don't want to do those things. So it's unfortunate, but they're doing the right thing. If you have a hospice company who's allowing your loved one to stay on hospice for years, I get it. It's helpful, but they technically are committing Medicare fraud and big time, not just a little bit. If they're being unethical. So I actually can't stand when hospice companies, I get it every once in a while for certain things where someone gives continuous care when it's not really needed, or they keep someone on for longer than they should. I get it. But if it's if they give everyone continuous care or they keep everyone on for years and years, that shows me that they're an unethical company and they're not going to last long because eventually Medicare will catch on, and they're doing it for the money, which makes them unethical. So, and it puts every other hospice company that's actually doing the right thing the right way in a bad light. So it's hard. Is Dilaudid, can Dilaudid also be used for difficulty in breathing? Yes, any narcotic or opioid can be used for difficulty breathing. We use liquid morphine because it's absorbed under the tongue and the gums, so it can work quicker, but you can also have liquid Dilaudid too. My fiance, the government tried to force him into hospice, but not want to, so pulled his money out from underneath him until he died. Sometimes pay extra for wound care. Ooh, Patty, that doesn't sound right, but I don't know. I'm sure that's a complicated case that I don't know anything about, but I'm sorry for your experience. Julie, I had my father live with me the last few months of his life. It was a good living experience. My mother died in hospice in a nursing home. It was rough. Her dementia made her paranoid. Oh, Kathy, yes. Thank you for being there for your parents. Best you can. I'm an aide. My patient has alpha-1 and has recently progressed significantly into her disease. All of the toes on her foot are purple each time I see her. Is this an indication that the end is near? No, not necessarily. So it could just be an indication that she has really poor perfusion to the bottom of her feet, but she should definitely see a doctor. Again, can't give medical advice, but I wouldn't necessarily say it's the end. It could be, but there's much more that has to happen for me to know if it's the end or not. Thank you, Paul. So I love this statement. No one knows when they will go, only when God says, come home, child. So old soul, I get it. However, and I do know that I can't say when someone's going to die, but this is what I think about that. So I do think we do a disservice in general as healthcare workers in the healthcare system by being afraid to tell people that they will likely die in X amount of time. Because I will say, as someone who does this day in and day out, we kind of do know-ish. We know enough, and we've seen it enough that we can help you plan and understand and tell you what's likely going to happen and when, to an extent. And I believe we owe it to people to give them some kind of outline so they can prepare and do what they want to do before they die. So having this blanket statement of like, only God knows, I get it. And I do believe in a higher power and a God. So it's not like I don't believe in that stuff. But I think that using that blanket statement for all things is actually harmful. Maybe not harmful, but it can be comforting. Yes. So I want to say like, yes, that's true. And as healthcare professionals, we owe it to our patients to explain exactly what we know to help them prepare so they can live their greatest life and die the most peaceful death they can, prepared. Just FYI. I'll get off my soapbox now. Do you guys see the soapbox? It gets real big from time to time, and I got to get off it. Hi, I joined you 9 years after my mom passed in palliative care. Even now, it has meant a lot to have so many questions answered. Oh, Louise, thank you. Glad I got to be a part of your second live. I'm actually in another city right now doing exactly that. I'm from Miami Shores and I'm in Whittier, Florida, caring for someone close to me. Wow, Catherine, thank you for doing that. Thank you for being here. Do you believe people who are passing are called into the light? When my grandpa was passing, he was talking about how bright the light was. I asked if my brother could pull down the shades. You know, I don't not believe that. I think I know enough to know that I don't know. And I would never want to say something like, yes, that does happen, or no, that doesn't happen, especially with something like going into the light or seeing angels or believing in God or seeing God, things like that. I know enough to know that I don't know. The light seems to be a typical theme. That's for dang sure. So do people go into the light? I sure hope so. And I hope it feels as good as they say it does. I've had many experiences where I feel like I have felt the feeling of what it might feel like, and it was amazing. And yeah, so I don't know, but I hope so. What do they have energy then? Oh, why do they have energy and then they pass? Again, that's one of those phenomena that happens at the end of life in about 30% of all of our patients. It's called terminal lucidity. The nicknames are called the rally or the surge. And it's when they're really, really sick looking and acting for however long. And then suddenly they get a burst of energy and feel really good and act like their old selves and maybe even walk, talk, eat, do a bunch of things that you're surprised about for usually about 24 hours, maybe a little bit longer, but usually not more than a couple days. And then they suddenly die afterwards. We are not sure why this happens, but it happens in about 30% of all of our patients. So 1 in every 3. About. My friend's sister was dying. She looked to her brother and said, I love you. Looked at her husband and said, I hate you. For some reason, I'll always remember and ponder that. Interesting. I wonder if they had a bad relationship or if it was like a funny thing. I don't know. Catherine says, I'm 62 and I think my body is closing down due to many medical problems. Is it too early to consider hospice? Catherine, you'd have to have a terminal diagnosis with less than 6 months to live in order to be on hospice. So if you have a terminal illness, something like a heart disease, respiratory disease, they have to be extensive, some kind of terminal cancer, you have to have a doctor that has said to you, you have a terminal illness with less than 6 months to live. It can't be something like diabetes, a thyroid problem, like a bunch of health issues that make your life harder, but it's not technically killing you. Hope that makes sense. But in general, I like to say something easy and quick so people remember it. I always say, when in doubt, check it out. So you always can talk to a hospice company and see. But remember, you get this hospice benefit over here, which is really good. Look at these nails, baby. They're not as long as they look, I promise. But you get this benefit over here, so you can sign up for all these things for hospice, but you lose the ability to go to the hospital, the ability to go to the ER, to see specific specialties, things like that. So you lose stuff if you go on hospice. So you don't want to do it too early, I don't think, especially if you don't have something terminal. Dying from Parkinson's. Hope to see this video later when I have time. Thank you, Julie. Oh, Catherine, I'm so glad you're here. So Parkinson's, I mean, obviously most people know it's a difficult, chronic, long, kind of slow, debilitating disease. Parkinson's is another hard one to get onto hospice because they basically will only take you on hospice or let you onto hospice when you're showing signs that it's really advanced and like the quote unquote like end is near, right? Which Parkinson's is one of those diseases that they can come on hospice and come off hospice, come on, come off because they get better. It waxes and wanes, right? So again, I feel like that disease should have its own category just so you can get your own special services and not have to worry about trying to get onto hospice. But it's a tough one. I'm so glad you're here. Thank you for being here. How does your work in hospice care affect your mental health, Henrietta? Every once in a while it does, Henrietta. In general, I was an ICU nurse for many years, which made me very passionate about death and dying and how do we do it, and let's talk about it more. And maybe it's not the worst possible thing if you have a terminal illness. Easy for me to say, right? I don't have a terminal illness yet, but I just seen the other side of it, the other side of fighting till the end with a terminal illness in the ICU. And I know that's not how I want to do it. And I don't want to be a part of it either as a nurse. I learned a lot. It helped me be a really good hospice nurse. So I'm glad I did it. So, and I say all that to say it doesn't totally affect my mental health because I don't think death is the worst thing. I think hospice is a great answer if you have a terminal illness and you know you're going to die from it. And I think what we do, here's a soapbox again, let's get on it. What we do as a society is pretend like maybe I'm going to be the one person who survives from this known terminal illness. And I know that's so, I hope I don't sound too harsh, but I feel like sometimes it needs to be said harsh for people to hear it. It's like, if you know you have this illness that is terminal, even though the doctors will say to you, well, 1%, da 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 da, and then we hang on to that 1%, and then we end up spending our lives in the hospital and then dying in a hospital because we refuse to believe that we could die from this. Versus people who understand it, accept it, and then eventually choose hospice when they're done doing whatever it is they have to do or doing the treatments they want to do to extend their life somewhat. So in my opinion, death is not the worst thing. Hospice is not the worst thing. So it's not depressing to me. It's not sad. It's like, good freaking job. Good freaking job. You're living your best life until you're not anymore. And we get to help people do that. So it is hard every once in a while when we don't do a good job at managing symptoms, which is rare, but it does happen. When people are unwilling to accept what's going on and I see them suffering a lot, I hate that. And every once in a while, I get really attached and I feel really involved and it's just heavy and sad and it's hard. But that happens very little. And AA really does help me with my mental health too. So that helps. Okay, off my soapbox. Thank you for that question. It's very good. I'm praying so hard for a second surgery, really am. Shane, I'm praying so hard for you too. I'm trying so hard for you too. I'm so glad you're here. And let me say this. I don't want to seem like I'm like talking bad about people who are thinking maybe I'm in the 1% of people who are going to survive this, right? I want to hope for that too. And if I ever get diagnosed with a terminal illness, I may be thinking that too. And I think there's a way where we can think and hope for that and still try to accept what is and die with grace and dignity. And I think the way to do that, like, well, how do we do that? I think is by this kind of stuff, by talking, by having a discussion, by being open about how we feel and what we're thinking and the reality of the situation. So yeah, there's nuance there. How to calm someone down a few hours from death. Maybe you mean, Angela, how do you calm someone down right before they're dying? Usually the person dying a few hours before death, they are usually unconscious. If they are not, and they are panicking, which I don't see very often, to be honest, I would use Ativan, benzo, to calm them down. Mm-hmm. Yep. And they need someone to be, they need someone to be there to say, hey, it's okay. It's okay. We got you. We got you. But in general, I truly don't see that very often. When my dad, I think people, so I don't see that very often. I think what I see are families who are not used to seeing someone dying, and they think their loved one is struggling and panicking. And that's just not usually the case. It's usually they're seeing the regular death and dying process, and they just don't know what that looks like. So they associate it with panic and pain and suffering. And that is the whole reason why I have a channel I have to help educate and show people what it looks like to die so they know what's normal. When my dad was on his deathbed, his vital signs all jumped and the nurse came running in. What happened? My brother had whispered a joke to him and he was apparently trying to laugh. Oh my gosh. So if he was getting vitals, he must have been in the hospital. So I'm wondering if he was on hospice or not. Usually on hospice, we're not taking vitals. But if he was in the hospital and his vitals were jumping all around, they probably came running in because his vitals were jumping all around and you're in a hospital and you're monitoring that much more than you would if you were on hospice. But I like that he was laughing at a joke. And your vitals jump all around at the end of life anyway. That's going to happen. Hence why on hospice, we don't even look at the vitals unless they're showing signs of discomfort or like something is wrong. People who are dying seem to be busy with visitors that we cannot see, but they see them. They will say, see so-and-so, and then name the person, and it's someone who has already died. Yes, Amy, I talk about this often. It's called visioning, and it usually happens, from what I've witnessed and what we say in our literature to educate families, usually a few weeks before someone dies, they start visioning. So it's not always like right before they die. Sometimes, but when someone starts telling me that they've seen people, I kind of note it in my head because usually they'll die within a few weeks of that. When my dad was passing away, he told me his father was watching us with other people. It felt so comfortable. That's amazing. Maria says fentanyl is strong. So fentanyl gets a really, really bad rap because of it being abused now in the world. And it is strong. However, it's a great drug when used correctly, and on hospice, we're never injecting it in IV. We always are using patches. It's a good way to manage pain. If someone's having a lot of pain, they don't have to constantly take pills and stuff all the time because the fentanyl patch only needs to be changed every 3 days. So it can be really effective. I'm all about fentanyl, but I realize that people are abusing it and dying. And as most of you guys know, I'm in addiction. I'm recovering. I understand addiction. I'm an alcoholic and a drug addict-ish. That's a whole nother story, but mostly alcohol by the time I quit drinking. But so I relate. No shame to the people who are struggling with addiction. But yeah, I feel like because of that, fentanyl gets a really bad name, and it's unfortunate. How many hours a day will someone on hospice be sleeping? My mother-in-law seems to sleep about 23.5 hours a day. Yes. T-shirt quilts, that is normal. That is very normal. I have a feeling she may have Alzheimer's dementia. Could I be wrong by saying that? But that's very normal. And as long as you keep her clean, safe, and comfortable, let her sleep, which it sounds like you are, but I wouldn't be concerned. I was bedside with my beloved and his family. He wouldn't hold anyone's hand but mine. All of a sudden, I said, he's leaving. Sing him out of here now. And then Sam passed. Oh, wow. Thank you for making that such a special moment. It's amazing. The Shaw family from New Zealand. Hi. My gosh, I'm so happy you're here. Thank you. My mom told us her dad had come to get her and she was ready to go. She passed 20 minutes later. Wow. The hospice community helped her so much before she passed, and me more than I can relay. Wow. That's amazing. I'm glad she saw her dad. That's really cool. I just wanted to say thank you. Thank you, Martin. Oh, thank you. If you die on hospice, do you still need a doctor to confirm the death? No. Some states make a nurse come out and confirm a death, but some states you don't have to do that either. But the nurses on where I work, we usually go out and confirm. Your videos helped me with my brother. He was dying. I did have some unanswered questions, and you seemed to know. Oh, thanks, Mary Kay. Megan, I love you too. My ride or die girl. I've been on a fentanyl patch for quite a while. My MD has changed mine every other day. Said they don't last 72 hours for everybody. Yes, Susan, you definitely can change. You definitely can change it more often, obviously, by your doctor. Will you be my sponsor? Lorena, I hope I'm saying your name right. I feel like you should get a sponsor who is in your area. That's just my opinion. But thank you for wanting someone to be your sponsor. I feel like you should go to AA meetings in your area and find someone that you want what they have and ask them. My mom has pancreatic cancer and is considering hospice. She has other health issues as well. I was wondering, in general, would some of those medications be discontinued on hospice? So they could try, some hospice agencies could try to push you to stop a lot of the medications. But you can fight for it. You can fight for that. I would say if you have a hospice company, come in and you ask them that question and say, this is really important to me. I want this medication to stay, and make them basically like promise that they won't discontinue it. And they usually won't, but you might have to fight for it. Some agencies are better than others. None of them are really wrong. It's just a matter of like knowing what you can advocate for. So basically, she won't be able to be on medications for the pancreatic cancer. Like she won't be able to get chemo and stuff. But if she has really extensive like high blood pressure or like high blood pressure, you can say, I want her to stay on her blood pressure medications and see what they say. Do you live your life differently from your knowledge of your work? I would say yes, and with the help of being in a 12-step program. Really, I mean, I don't mean to keep driving this home. I know everyone has their own journey. Not everyone's an alcoholic. But being in a 12-step program has really, I mean, that has really changed the way I live and the way I think. That has really helped. Yes, just like what Megan said. I am Hospice Nurse Julie across all social media. So Facebook, Instagram, TikTok, YouTube. I am going to start working on YouTube a little more, maybe doing some interviews with people, doing different things here, just because you can. And I love YouTube. It's great. My uncle, who was mentally handicapped, said he saw Garfield, his favorite cartoon, and he said he told him he was going to be going to a new home. It's amazing how he was met where he was mentally. Wow, that is really amazing. I've never heard that before. I love that. That is so amazing. I wish I had known about your channel before my husband passed. Thank you for explaining things. I was clueless. Oh, thank you for being here, Harley. Yeah, I'm glad I quit smoking too. My goodness. Julie, will you take care of me when I'm dying? I'm in Washington. John, I'm in California, but I have a really good hospice nurse up in Washington. Her name is Hospice Nurse Penny. She's on here too, if you want to follow her. Hospice Nurse Penny. She is good. Hey, Serafina. Hi, Julie. I'm from Australia. My 96-year-old grandmother suffered a huge stroke and was no fluid. She waited 3.5 weeks until my uncle was contacted and came back to Australia from Europe. So she basically waited for everyone to get there before she died. Is that what I'm hearing right? I do see that. That's amazing. That's amazing. My mom is 102. She is sleeping 18 to 20 hours a day. Dementia has set in. Otherwise, she is healthy. Should I be worried? What does that mean? Is she going to die soon? Linda, I really hope you're still here because I would love to answer this question for you. So the whole idea of should I be worried? Not that, I don't mean to, I know it's your mother. So of course there's emotional things behind this, but I would say everyone has an end of life journey, right? No matter, even if you're in the toppest shape of all health, if you are 102, I don't know if the idea of like being worried about her death, I don't know if I word it like that, right? Like she is definitely close to death. Even if she was, well, she doesn't have dementia and she was only sleeping 8 hours a day and eating 3 meals a day and walking around and being fine, and seeming fine. At 102, you are close to death. That's it. So the way I would look at that is, should you be worried? No. But knowing that she's close to death, I would say yes. Is it 6 months? Is it 2 years? It's hard to know, but she is sleeping majority of the day, very normal. If she is clean, if she's safe, if she's comfortable, you're good. And all you can do is just be with her and make sure she's clean, safe, and comfortable. The sleeping, that's pretty typical. I would say, I don't know if she's on hospice or what her deal is, but I don't know if she's on hospice is what I mean. But I would say, yes, she's close to death in the sense of she's 102. And I don't mean that like she's 102, so who cares? That's not what I mean at all. I just mean factually, like logically, that's where we're at. So all you can do, you can't really do anything except for be with her, keep her clean, safe, and comfortable, and be present with her. I always like to remind everybody that death is not an emergency. If you're on hospice or if you're end of life, and she is end of life. Just because she's 102, that's it. Like you are, she is end of life, like no matter what you did, right? We can't live forever, unfortunately. So I always like to say that death is not an emergency. It's nothing you have to like panic about when it happens. Because especially on hospice, like we know what's coming. So can you teach yourself and learn how to be present in the moment to not miss it, right? To not miss it. Because I think death is like birth, like to witness a birth. And again, it's easier for me to say because I'm removed from the sadness of it, right? But if you think of a birth, how magical it can be to witness a baby being born, right? It can feel magical and like, holy shit, that was wild. I feel like death can be like that too. Death can be like that too if we can try to be present, not feel panic, know that everything that's happening is a natural thing, and we can witness someone's last breath on earth, in a loving, honoring, sacred kind of way. If that makes sense. Got a little bit on a tangent there, a little bit on a soapbox and a tangent. I appreciate you guys. I want Julie there when I croak. You guys are so great. Thanks, J.W. Wakefield. Hello from Westchester County, New York. I feel like I have friends in Westchester, but they're in Philly, I feel like. Anyway, I'd like to know if it's automatic that you go on hospice if dialysis doesn't work anymore, or if there's another procedure they can do to extend your life. No, it's usually automatic, Catherine. Usually. You can still decline it, but I wouldn't. If your body's no longer tolerating dialysis, they could, 100% don't take this as a medical advice. I would talk to the doctor that you or whoever you're talking about are working with to see what they say. But as far as I know, no, once dialysis is no longer working, or the person says enough is enough, or their body can't tolerate it, they usually have to go on hospice. I will say it's one of the more gentler deaths. It's very predictable, and there's not many symptoms. So it's usually 7 to 10 days after stopping dialysis, depending on if they're making urine or not, but usually about 7 to 10 days. And the main symptoms are confusion, extreme lethargy. So they're going to sleep all the time, all the time. So sleeping all the time, confusion, and then some itching. But other than that, and it's very predictable. So you kind of know, okay, 7 to 10 days from now, this is what we're doing. But so it is a more peaceful death. People always say, like, I want to just go to sleep and never wake up. It's kind of like that. Rose says, I have COPD, so I watch you a lot. Rose, I'm so glad you're here. I nearly died once, saw the light, and it was beautiful and amazing. Yes, girl. A friend of mine is on hospice now. He is experiencing Vietnam memories. Scarlett, I do see that sometimes. People will revert back to traumatic times in their life, unfortunately. I've taken care of a lot of Holocaust survivors, and many of them will revert back to that time and have a lot of agitation. I would medicate for that personally. I mean, not that you need to do that, but that's when I had patients like that, we had to medicate them. How long does it take to die from COPD? That's a long chronic illness that you're only on hospice at the very, very end of. So a long time. You can live, not die. You can live with COPD for a long time. Someone else was just saying they were on here because they have COPD. I'm sure they can attest to that. The way I talk about chronic illnesses like COPD, congestive heart failure, dementia, Parkinson's disease, it's like a stairway. So you're here, you're living your life, you're kind of debilitated, like your life is not as independent as it once was because of this disease. Then something happens, boom, and you fall down here. And you're like, oh man, this is rough. I'm really sick. I can't believe this. Like, you needed a lot of help. Maybe you're in the hospital. Maybe you got an infection. Maybe you fell. But then your body will say, nope, we're not done yet. And you'll slowly crawl up, and then you'll plateau out here. So you were here, down, now you're back up here, and you're plateauing here for quite some time, maybe years. And then something happens again. So it's this big, long stairway of decline over a year's period. Whereas some kind of like quick terminal cancer diagnosis, you can be like diagnosed, you're here, and then down, and then you die. And this could be a months period, or maybe a year or two period. And it's more of a steep decline, if that makes sense. I recently lost my dad 8 weeks ago. Because of you, I was able to remember all the things you said about peaceful passing. I was not afraid, even though my heart was broken. Oh, wow. My dad's passing was tranquil. Dawn, thank you so much. Hearing messages like that really mean the world to me. Thank you. Thank you for being here. Thank you for being there. You probably made all the difference in his passing. So thank you. From what age should we prepare our death? I think now, man. I think now, baby. No time like the present. I mean, I think my pulse, right? My do I want to be DNR or full code, intubated, CPR, things like that, is going to be different now than it is when I'm 75. But I think it's always time to talk about death. It's always time. We always should. We don't need to always talk about it 24/7, but it should be a thing we openly talk about what we would want. If this happened, if that happened, if I'm in a car accident and I'm brain dead and I'm on machines, you better freaking believe my family knows to take me off machines. That's what I personally want. So my family knows I want to be cremated or some kind of natural burial, whatever. I don't want them to spend a bunch of money on my burial is the thing, right? So things like that. Like, I think everyone should be talking about this all the time. This should not be a thing that we hush under the table. So yeah. Where was I with these questions? Megan, me and Michaela duo. Michaela is my favorite makeup artist. I don't do anything with my eyes because it like gives me headaches, but I love on TikTok. I like love watching makeup people. I just think it's fun. May I ask if you have kids your age? I'm a New Yorker. We ask a lot of questions. Congrats on your 7-year sobriety. Thank you. I have no children. I just turned 40 this year. I'm from Pennsylvania, but I've lived in California for over 10 years now. And before that, I lived in Baltimore, Maryland. I would like to get married. And now that I'm 40, it's getting a little up there, but I would like to have a kid. We'll see. No comments about that, please. I'm sure people have a bunch of opinions about it. John says, I hope you're still here, John. It would have been my brother's 59th birthday today. He passed away on 4/6/19 from colon cancer. Glad you're here. Okay, it's 3:33. You guys are the best. Okay, it's 3:33. I've been on for 50 minutes. I probably should go. It's been a long time, but you guys have been the best. Thank you so much for showing up for my lives. I'm going to start. I keep saying that I'm going to start getting a little more organized on YouTube, but I will. I'm going to start getting a little more organized. Maybe doing a live once a week, like every day, a certain time. But this was great. So nice seeing everybody. Thanks for helping me stay busy on the Super Bowl Sunday. And I had a baby at 50 natural. Go for it. Hey, Jay, that's amazing. John, you're still here. Good. Elizabeth says, I'm from Canada. I'm a death doula for animals and people, inspired for caring for my dad at the end of life. Wow. Elizabeth Wright, that's amazing. Hi, everybody. 43 and pregnant right now. Oh my gosh. I love it. Thank you guys. Yeah. Thank you guys so much. Megan, thank you so much for being here and supporting me always. You're so sweet and supportive. Thanks for everyone who said thank you to me. I did see that. I didn't read those out loud, but I appreciate it and thank you. And just have a great day, you guys. And I'll be back. Okay. Oh, my book will be available. It's unfortunately, it takes a long time to get a book published. So it's going to have a whole launch. I'll make sure I tell you guys it's gonna be a big deal. Well, I'm going to make it a big deal because I can't believe it. Probably June 2024. So it takes a full year to get things going, but we'll get it out there and I'll make sure you guys are the first to know. Actually, me and Nurse Penny are doing a retreat in September. I'll make sure I get all of this out so you guys don't have to. When I know stuff, I'll tell you. But Nurse Penny and I, Hospice Nurse Penny, if you don't know who she is, we are doing a retreat in September in North Carolina. It's going to be amazing. We haven't started organizing or telling everybody yet, but you're the first to know. You heard it here first. Okay. I think I'm funny. I don't know about you guys, but I think I'm funny. Okay. You guys are the greatest. Mwah. I'll talk to you later and have a good Sunday. Bye.